The first region of the body that we're going to focus on is the shoulder and arm. This is Chapter 2 in the Trail Guide to the Body text. We're going to take a look at the distinct bones and bony landmarks. We're going to activate and contract the muscles. We're going to outline them. We're going to then palpate the distinct muscle bellies and the bony landmark or tendinous attachment sites. With me today is Gina Walter. She will be the model throughout a large portion of this video. We're going to begin by focusing on the deltoid. We'll start by palpating the bony landmarks of this region. We're going to first identify the medial border of the scapula, the spine of the scapula, the lateral acromion, and then the lateral clavicle and the deltoid tuberosity of the humerus. Those are the attachment sites for the deltoid muscle. Now let's activate this muscle so that we can see the distinct margins of the deltoid. Here's the anterior margin of the anterior deltoid, the posterior margin of the posterior deltoid. We're going to relax the arm. And now we're going to passively abduct the arm and use a pincer palpation technique, starting at the lateral clavicle and making our way down to the insertion point on the deltoid tuberosity. We'll come back up to the lateral acromion and use the same pincer palpation technique as we make our way through the middle deltoid. Then we'll palpate the posterior deltoid with a pincer palpation technique as we make our way down and identify the deltoid tuberosity on the humerus. Let's take a look at this muscle on Julie, another one of our models. So you can see the distinct muscle bellies of the middle deltoid, anterior deltoid, and then push back a little bit. And then we can see the posterior deltoid as they all converge and attach onto the deltoid tuberosity. So I can use a pincer palpation technique to lift and trace the muscle belly of the posterior deltoid down as it makes its way into the insertion point on the deltoid tuberosity. And then just let your arm go if you can. Good. And then for the middle, we're going to locate the flat acromion, lateral aspect of the acromion, and pick up the muscle belly of the middle deltoid as we trace this muscle once again down onto its attachment onto the deltoid tuberosity. We'll come around the front and locate the clavicle, the lateral aspect of the clavicle. Here's the lateral end of the clavicle. Just let your arm go. Good. And we'll begin using a pincer palpation just to lift and palpate this muscle and follow it down to where it inserts onto the deltoid tuberosity. Now let's take a look at this muscle on Kevin, who's a power lifter and bodybuilder. So here we see the posterior deltoid. Here is the middle deltoid, and this is the anterior deltoid. And relax. So in order to palpate the posterior deltoid, we're going to use a flat palpation following the spine of the scapula until we reach the muscle belly. Then we'll transition into a pincer palpation. We're going to lift that muscle belly up and trace it all the way down to the lateral aspect of the humerus where it inserts onto the deltoid tuberosity. We'll use a flat palpation and strum across that insertion point. We'll come back up and locate the flat acromion of the scapula, and then we're going to use the pincer palpation technique to trace this muscle belly down once again until we lose its insertion onto the deltoid tuberosity of the lateral aspect of the humerus. We'll come back up and we will locate the lateral clavicle. And I'm going to use a pincer palpation to pick up the muscle belly of the anterior deltoid and trace it down once again until we reach the insertion onto the deltoid tuberosity. So now we're going to just take a look at the layering system of the muscle groups of the back. So we have the upper trapezius, right? We have the upper trapezius, the middle trapezius, and the lower trapezius, so the most superficial layer. The erector spinae, which fiber direction run in this way. The lower trap has an orientation or fiber direction that runs obliquely. The middle fibers of the trap runs transversely, and the upper fibers of the trap run along the nape of the neck. Underneath this muscle group, we've got the rhomboid minor and the rhomboid major, that the fiber direction runs in this direction. And then we have deep to this, of course, iliocostalis running upward and underneath part of the scapula, longissimus running upward, and spinalis running up along the spine. Okay, can you just bring your arm in here like this, Jewel? Good, and then just push up into my hand. You can see the middle trapezius, muscle fibers of the middle trapezius, the lower trapezius here, and relax. And then shrug your shoulder up for me. Yeah, towards your ear. Good. We can see the upper trapezius. This is a good orientation lower on both sides. We can see that bilaterally really nicely here. Now let's take a look at the lower trapezius and the middle trapezius on Gina. First, we'll contract this muscle by raising the arm up over the head. You can see the lower trapezius muscle. Here's the lower trapezius fibers once again, the middle trapezius fibers, as they make their way over and attach onto the scapula. We're going to begin at the spine of the scapula and palpate the lower trapezius muscle using a pincer palpation technique. We'll use the other hand to shorten the muscle fibers as we lift up and trace the outline and borders of this muscle, making our way all the way down to the spinous processes of T12. We'll then work our way back up to the spine of the scapula, and then we'll palpate the middle trapezius muscle from the spinous processes of C7 down to T7 over to the medial border of the scapula. Now let's take a look at the upper trapezius muscle. We'll begin by contracting this muscle. Gina's going to raise her head up. We can see the upper fibers of the trapezius muscle here. You can outline the borders of the upper fibers as it makes its way to the lateral acromion, the lateral clavicle, and the spine of the scapula. We'll begin the palpation using a pincer palpation technique at the occiput and working our way down to the base of the neck. We'll continue to follow this muscle as we make our way to the lateral aspect of the shoulder, the lateral acromion, the lateral clavicle, and the spine of the scapula. We can move towards the midline and pick up a larger section of this muscle and work from the midline once again to the lateral shoulder. So if we outline this muscle, this is the outline of this muscle right here on the right trapezius, upper trapezius, middle trapezius, and lower trapezius. To palpate this muscle, we're going to use a pincer palpation technique, and we'll trace this muscle all the way out to the lateral clavicle and lateral acromion. We'll use a flat palpation technique to palpate the muscle fibers of the middle trapezius to the spine of the scapula. We'll transition to a pincer palpation technique as we pick up the muscle belly of the lower trapezius. Or we can use a flat palpation technique and strum across the muscle belly of the lower trapezius muscle. Okay, so we're going to begin with the attachments for the latissimus dorsi, and the inferior angle corresponds with approximately T7 to T8. So this attaches onto the spinous processes of T7 down to T12. And it also attaches onto the thoracolumbar aponeurosis and along the iliac crest. That's the origin of that muscle. So we're just tracing the bony landmarks here of the attachments. This flat muscle comes up underneath the axilla and attaches onto the anterior portion of the shoulder on the crest of the great and the lesser tubercle. Okay, now we're going to activate the latissimus dorsi and the teres major. So let's turn the arm into medial rotation, Gina. Go ahead and turn it that way, and like in this way. There we go. And then go ahead and just raise the arm up towards the ceiling. We can see the teres muscle here. Let's bring it out here and go ahead and push up into my hand. And now we can see the lat a little bit better, the margin of the lat. Relax. So, in order to palpate this muscle, we're going to just go just off the inferior angle. It's the easiest place to pick it up. And we're going to pick up, that's the latissimus there, those tissues there. The fibers that just slipped through my fingers. So we can follow that all the way up until it tucks underneath the shoulder at the axilla. And then we're going to trace it down lower aspect of the thoracolumbar aponeurosis to where we lose it. And then we can distinguish the lat from the teres, because here's the bony landmark of the inferior angle of the scapula, and then the lateral border of the scapula runs right along here, and we can run our thumbs across that muscle belly. You can see me strumming across a thick muscle belly there. Let's just have you push into my hand, and there's that muscle running. Same thing, dives deep underneath the axilla and attaches to the lesser tubercle. Now let's take a look at the teres major on Julie. Here we can see the large muscle belly of the teres major, and then outlining the borders all the way down of the lat. relax. So I'll begin by picking up this muscle and tracing it. Transitioning to a different finger position or a pincer palpation technique. Following the borders of the muscle.
It's so ticklish to palpate in the axilla. Actually, there are many dangers that lie below besides a sweaty armpit. As we're palpating this area, we have to be aware of the axillary artery, nerve, and vein, and there are, of course, the axillary lymph nodes. Be very cautious. This is a tough spot to palpate your partner in.
All the way up to the axilla, where you lose the muscle belly. Here's an outline of the teres major muscle. Both of these muscles insert on the crest of the lesser tubercle of the humerus. Let's take a look at this attachment site from an anterior view on the skeletal system. Now let's take a look at the rotator cuff muscles. We'll first identify the supraspinatus muscle, which occupies the supraspinatus fossa, located here. It runs across to the lateral aspect of the shoulder and inserts onto the greater tubercle of the humerus. And then we'll outline the infraspinatus muscle, and it inserts onto the greater tubercle of the humerus just posterior to the supraspinatus. And underneath the deltoid, we'll locate the teres minor muscle, which attaches on the upper half of the lateral margin of the scapula and inserts onto the greater tubercle. We'll identify the medial border of the scapula, the lateral border of the scapula, and the spine of the scapula. We'll also try to locate the head of the humerus through the deltoid. We'll use a flat palpation technique to identify the insertion points for the rotator cuff muscles on the greater tubercle. Now we'll activate this muscle group by having Rob do external rotation, and this will activate the infraspinatus and the teres minor. Now we're going to activate the subscapularis by contracting the muscle into medial rotation. We're going to palpate the supraspinatus muscle, one of the rotator cuff muscles. We're going to begin by just locating the medial border of the scapula, finding the spine of the scapula. We're going to trace this bony ridge all the way to the lateral aspect of the shoulder. We're going to outline the acromion here. This is the lateral aspect of the acromion. Here's the anterior aspect of it. And then we're going to also locate the clavicle, the lateral aspect of the clavicle, which comes over to the lateral aspect of the acromion and meets and forms the acromioclavicular joint. In this, above the spine of the scapula, in this fossa is the supraspinatus muscle. So we'll trace this muscle belly from the medial aspect of the body. We'll work our way over to the lateral aspect of the shoulder. It stops here at the AC joint and it dives underneath the acromion, and it comes out on the other side and attaches onto the greater tubercle of the humerus. This muscle is a strong abductor. So let's bring your arm up to your side here, Rob, and see if we can just activate this muscle. So right through here, that's the muscle belly. The attachment is deep to the deltoid on the greater tubercle of the humerus. Now let's take a look at the supraspinatus muscle, which is part of the rotator cuff. We'll begin by activating this muscle. Lynn, can you push your arm out into my hand? right along here is the supraspinatus muscle. And relax. We'll ask Lynn to move her head out of the way slightly. The origin of this muscle is located underneath the trapezius, which we see here. This is the trapezius muscle, located on the supraspinous fossa of the scapula. Use a flat palpation technique to trace the muscle belly and fibers as we make our way to the lateral aspect of the shoulder. We run into the acromion process. This muscle dives underneath the acromion, comes out and inserts onto the greater tubercle of the humerus, located right here. So let's take a look at the muscle fibers of the infraspinatus first. So the upper fibers, we're just going to do a flat palpation beginning right underneath the spine of the scapula and following that muscle over to the humerus where it attaches onto the humerus. Now this is challenging on an individual like Rob because he's got a lot of musculature here, posterior deltoid, so you have to kind of palpate through that. So the actual insertion of that muscle could be difficult to find unless we do a little bit of rotation. Just let me rotate it, unless I just rotate his arm a little bit so I can feel that greater tubercle come underneath my finger. And the insertion is approximately right there on the greater tubercle. The other fibers we can see are thick. There's a thick band here. We're going to run across, once again, all of this, and then we have the lower fibers down here, all converting and attaching onto the greater tubercle. Now let's take a look at two of the rotator cuff muscles, the infraspinatus and the teres minor. First we'll contract or activate this muscle group. So go ahead, Lynn, and externally rotate your wrist into my hand. Good. This is the posterior deltoid. Here's the muscle belly of the infraspinatus running underneath the posterior deltoid. And then we have teres minor underneath the deltoid as well. And relax. First we'll palpate the infraspinatus. The infraspinatus originates on the infraspinous fossa of the scapula, located, here's the spine of the scapula, here's the medial border. This muscle belly occupies this infraspinous fossa, located here. This muscle inserts on the greater tubercle of the humerus. We may have to roll the arm into external rotation a little bit to feel the attachment site. So to palpate this muscle, we'll use a flat palpation technique to strum across the muscle fibers of the infraspinatus. It runs underneath the deltoid right here. So we'll trace that muscle and the tendon as it makes its way onto its insertion point on the greater tubercle of the humerus. Okay, so the next muscle that we're going to palpate is going to be the teres minor. The teres minor attaches on the upper 1/3 of the lateral border of the scapula. So we're going to just ask Rob to kind of externally rotate his shoulder a little bit so we can kind of feel that muscle activate, and then relax. This is a little bit tricky because also the posterior deltoid also externally rotates. So we really have to feel for the depth of the tissue, and also we have to look at the fiber direction. The deltoid is coming here, and the teres is a little stronger angle. So I'm going to roll across this muscle. Right there, we can see that muscle belly. And it's usually a relatively dense muscle. So we start at the lateral upper 1/3 of the scapula, and we work our way over, once again, to the facet of the greater tubercle. But it's challenging unless we roll the arm on Rob. We have to go through the deltoid, and then we can feel that attachment on that greater tubercle. Now let's take a look at the teres minor. The teres minor originates on the superior half of the lateral border of the scapula. Here's the lateral border of the scapula. So the superior half of this region. So we'll go in with a flat palpation to locate the origin of that muscle. We'll use a flat palpation to strum across the muscle belly. As we trace it, it goes underneath the deltoid, over, and inserts once again into the greater tubercle of the humerus, which we may have to passively roll the humerus to feel those attachment sites or the insertion point for the teres minor. Now we're going to palpate the subscapularis, which originates on the subscapular fossa, which is on the undersurface of the scapula. So in order for us to access it, we've turned the client into the sideline position, and we're going to use the border of the lat. This is the border of the latissimus.
It's so ticklish to palpate in the axilla. Actually, there are many dangers that lie below besides the sweaty armpit. As we're palpating this area, we have to be aware of the axillary artery, nerve, and vein, and there are, of course, the axillary lymph nodes. Be very cautious. This is a tough spot to palpate your partner in.
We're going to slide up into the axillary region. We're going to come underneath the scapula onto the anterior surface of the scapula, and we can strum across the muscle belly of subscapularis. So subscapular fossa is the origin, and let's just have you activate that muscle, Rob, so I can feel that muscle as he does medial rotation, a resisted medial rotation. I can feel that muscle contract underneath my thumb, and it just depends on the origin of the placement of your hand in regards to how much of this muscle you can actually palpate. Rob has a relatively large lat, so we have to go underneath all of the lat tissue and actually traction the scapula out over this thumb to be underneath the scapula to palpate the muscle belly. Now we're going to palpate the subscapularis, which is one of the rotator cuff muscles. We'll begin by locating the edge or the margin of, here's the latissimus, here's the teres major. We're going to lift the arm up, slide underneath those muscles to the anterior surface of the scapula on the subscapular fossa, which is the origin of this muscle. Now let's take a look at the insertion of the subscapularis. The subscapularis inserts on the anterior portion of the humerus on the lesser tubercle. In order for us to palpate this bony landmark, we're going to passively externally rotate the shoulder so that we can locate the insertion point of the subscapularis muscle. So the insertion is on the lesser tubercle of the humerus located here. Okay, now we're going to palpate the rhomboid minor and rhomboid major, and those muscles are attaching onto the most prominent cervical vertebra, which is C7, T1, T2, T3, T4, and T5, spinous processes. The minor inserts onto, beginning at the superior angle of the scapula, down to the root of the spine of the scapula. So that muscle runs right here, and then from the root of the spine down to almost the inferior angle of the scapula is the rhomboid major. This is an intermediate muscle, so we have to palpate through the trapezius, the middle trapezius running this way, to access this muscle. This muscle is best palpated by using a flat palpation and strumming across the muscle belly. So we can feel the muscle fibers as we work our way from the spine over to the scapula. So that would be the superior margin of rhomboid minor. This would be the inferior margin of rhomboid minor. And then we'll move down and we'll strum across the muscle fibers of the major, starting at the spine and working our way lateral to the medial border of the scapula. And that is the inferior margin of the rhomboid right there. You can feel it. Now we're going to take a look at the levator scapula. We'll begin by identifying the origin of this muscle. Let's try to contract it. Todd, can you just raise your head and neck up? So this muscle runs right along this region of the posterior neck and shoulder. Relax, thank you. So first we'll locate the mastoid process of the temporal bone. We'll come inferior and medial, and we should feel the transverse process of C1, and just a little bit deeper C2, C3, and C4. That's the origin of the levator. Levator comes down underneath the upper trap and inserts onto the medial border of the scapula and the superior angle of the scapula. So to palpate this muscle, we use a flat palpation, and we will strum across the muscle belly, following it from the superior angle all the way up to where it originates on the transverse processes of C1 through C4. And the levator runs from the superior angle of the scapula. It runs up the posterolateral aspect of the neck and twists around itself and attaches onto the transverse processes of C1, C2, C3, and C4. So that muscle runs up, twists around itself, and attaches right onto the transverse process of the upper cervical vertebra. So in order to palpate this muscle, we want to locate the superior angle of the scapula, and we're going to use a flat palpation and strum across the muscle belly of levator. It's usually a dense and fibrous feeling structure. And it comes out right here in front of the trap. You can feel it probably the easiest right in front of the trap, because here's the trapezius running up right there, and right in front of that you can feel levator. So to do a muscle test for this, we'd have the client turn their head towards us and then extend, and that would be an isometric contraction for levator scapula. Now we're going to palpate the pectoralis major muscle. The pectoralis major has attachments onto the medial clavicle, onto the sternum, and the cartilage of the first 6 ribs. runs over and attaches onto the crest of the greater tubercle of the humerus. So let's contract that muscle so we can see the outline muscle fibers. Go ahead and pull in. We can see the clavicular fibers. Here is the sternal fibers, and here's the costal fibers down below. And relax. In order to palpate this muscle on someone with the development like Kevin, we can actually, on this clavicular belly, we can actually do a pincer palpation, tracing that muscle from the midline of the body over. As this muscle travels laterally, it dives slightly under the anterior deltoid. We're going to use a flat palpation and locate its insertion. Go ahead and pull in again and relax. So I can continue to trace that down by having the muscle contract one more time and relax. Good. Then we can use, once again, a flat palpation to feel the distinct muscle fiber direction on the sternal fibers of this muscle. We're going to follow that over towards the shoulder. Once again, as it converges and attaches onto the crest of the greater tubercle of the humerus. The lower fibers, we can do the same thing. We can actually use a pincer palpation also to pick up this muscle and trace the margins of this muscle all the way over. And actually, if we passively flex the arm up and just relax, if I passively do it, I can pick this muscle up using my fingertips all the way over, and then use a flat palpation to palpate the insertion point. Now we're going to palpate the pectoralis major muscle on Julie. First, we're going to contract this muscle group by raising the arm up to about 90 degrees and then pull inward for me. We can see the distinct heads of this muscle. Here's the clavicular head, here's the sternal head, and then the costal head. This muscle runs across and attaches onto the crest of the greater tubercle of the humerus. This is also a good indication of and location of the anterior deltoid, located here. You can see the clavicle and the deltopectoral triangle. And relax. Just going to bring the arm. I'm going to keep the arm up slightly so that I can pick this up. You can just let it go. I'm going to use a pincer palpation. This muscle attaches onto the medial half of the clavicle, so we'll begin there. We're going to trace it as it makes its way across the shoulder joint. I'm going to change hand position, palpate it as it inserts onto the greater tubercle, the crest of the greater tubercle of the humerus. I'm going to come back across and pick up the sternal head as we follow it across. As it makes its way and inserts in the same location, the crest of the greater tubercle of the humerus. We'll use a flat palpation to follow the ribs 1, 2, 3, 4, 5, and 6. That muscle runs here and across and attaches into the crest of the greater tubercle. We'll use a flat palpation on the lower portion of it, costal head, and then we'll use a pincer palpation to pick it up and trace it as we make our way over to the crest of the greater tubercle of the humerus. So we can see the outline of this muscle. Here's the tendinous attachment, the muscle belly as it runs up and attaches or originates up here at the supraglenoid tubercle. And then we also see the attachment here, the bicipital aponeurosis. And we can outline this muscle also running up. And the short head attaches right up here on the coracoid process. Go ahead and relax. We'll begin by starting at the distal end of this muscle, and we'll use a pincer palpation to pick up the tendinous insertion on the radial tuberosity, and then we'll strum across the bicipital aponeurosis. Then we'll use a pincer palpation to work our way up towards the shoulder, lifting this muscle up, feeling the muscle belly. When we get to about right here, it starts turning into a tendon again. So then we're going to use a flat palpation, and we're going to strum across that muscle. We can see it moving completely up on top of the shoulder. The tendon runs in the floor of the bicipital groove, or the intertubercular groove, and attaches on the supraglenoid tubercle. So if we move a little bit medial to that, we will feel the short head, that's the long head, and then the short head runs up and attaches onto the coracoid process. So we'll just use a flat palpation, a strumming technique across that tendon. And then let's just activate the muscle one more time so we can see the outline. So radial tuberosity, bicipital aponeurosis is the insertion. We have the belly of the muscle here. We have the long head running up the bicipital groove and attaching on the supraglenoid tubercle. The short head runs up and originates onto the coracoid process. Now we're going to look at the relationship between anterior deltoid, pectoralis major, and we're going to palpate the biceps brachii. So what I'm going to do is bring the arm into a little bit of flexion. Go ahead and pull your palm of your hand towards your shoulder. Good. We can see the large muscle belly of the two bellies of the biceps brachii here. And relax. So the attachment sites for this muscle are going to be somewhat challenging on a body that's developed the way Kevin has such development in his shoulder. So what we're going to do is trace once again. We're going to get our landmark so we know where we are. We're going to find the lateral aspect of the clavicle, and we're going to come inferior and lateral slightly, and we're going to feel for a bony prominence there. That's the coracoid process of the scapula. That is the attachment site for the short head. So in order to palpate this, I'm going to use a flat palpation as I strum across that tendon and make my way down the arm, the anterior surface of the arm, until I can feel muscle belly, and then I can transition, actually, and just relax, can transition into a pincer palpation technique, following that muscle belly down, until it inserts onto the tuberosity of the radius and the bicipital aponeurosis. So let's go ahead and pull the arm up again so we can just feel those tendons. So there's the tendon. This is all muscle belly, and that dives into this anterior portion of the forearm and inserts onto the tuberosity of the radius. We can also do a flat palpation